Hello, my name is Laura Dickens, and this is my final video assessment. This is Anthony, and he will be assisting me today with my head-to-toe assessment. We're going to begin with the Snellen chart, Anthony. Anthony, do you wear corrective lenses?
Yes.
Okay, and do you have them in now?
Yes.
Okay. And what do you use them for, nearsightedness or farsightedness?
Farsightedness.
Okay. So, Anthony, we're going to begin here with the Snellen chart. If you can tell me what line can you read comfortably?
D, E, F, P, O, T, E, C.
Okay. And could you go to the next line?
L, E, F, O, D, P, C, T.
And can you go one more?
R, P, D, L, T, E, C, F, B.
Okay, that was 2015, and you've gotten 4 right on that line. Okay, so Anthony, I'm going to tell you, what color is this line?
Green.
And this line?
Red.
And which line is longer?
Green.
Okay, so your depth perception as far as the Snellen chart is intact. Anthony, I'm going to have you sit down. We're going to take a look at your blood pressure. And where does your blood pressure usually run, Anthony?
110 to 60.
110 over 60?
Yeah.
Okay. Okay, Anthony, I'm going to have you relax your arm. And I'm just going to assess your brachial pulse here. And you have a +2 brachial pulse. I'm going to assess your radial pulse. And your radial pulse is +2. So, Anthony, what I'm going to do is I'm going to inflate this cuff. And I'm going to feel for your pulse. And I'm going to stop when I don't feel your pulse anymore, okay? Okay. So I didn't feel your pulse at 120. So when I reinflate to look at your blood pressure, I'm going to go 30 above that to 150. And once again, relax your arm, Anthony. All right. Just going to reinflate the cuff. Okay. 122 over 60. And normally in a new patient, what I would do is I would assess both sides to make sure they were close in number. Okay, Anthony, so the next thing I'm going to do is assess your skin, okay? Okay, your skin is warm and dry. You have a nice tan. Good elasticity. Good skin turgor. I'm just going to check on your chest. Instant recoil. Okay, I'm just going to look for lesions. And I do see one right here on your neck, so I'm going to have you turn your neck a little. It is slightly elevated. It is round and symmetrical, a light brown in color. The borders are clearly defined, and we're just going to measure that. Okay, can you just move your neck over just a little? Okay, and 2 millimeters. All right, so next thing we're going to do is look at your head and scalp. You're just going to feel me touching your head, Anthony, okay? Okay, light brown hair, evenly distributed, soft and clean, no masses or lesions. Do you have any tenderness when I'm doing this?
No.
Okay, very good. Very good. Okay. So now I'm just going to look at your face. Look at your palebral fissures are symmetrical. Can you smile for me? Very good. Your nasolabial folds are symmetrical. I'm going to be checking the muscle strength in your temporal and masseter muscles. So what I'm going to have you do is clench your teeth. Okay? Can you clench your teeth for me? Good. Any tenderness with that?
No.
And clench your teeth again. Very good. So we have 5 out of 5 strength in the temporal and masseter muscles. Now I'm going to check the range of motion of his TMJ. So Anthony, what I'm going to have you do is open your mouth and move your jaw side to side and protrude and retract in and out, okay? And I'm going to be feeling your TMJ right there. Okay, can you open your mouth? Can you move your jaw side to side? Very good. And can you protrude and retract? Any pain with that?
No.
Okay, just a little popping there, but that is a normal finding, and that's okay. Okay, Anthony, so next, what I'm going to do is look at your eyes. Okay, so your eyes are equal and symmetrical on your face. Next thing I'm going to do is assess cranial nerves 7 and 12. So what I'm going to have you do is clench your eyes and don't let me open them, okay? Good. Good. And can you wrinkle your forehead? Can you puff your cheeks out? Can you smile? All right. Can you clench your teeth? All right. And can you stick your tongue out? Okay, so you have normal facial features. Next thing I'm going to do is get the ophthalmoscope, and I'm going to be looking at your eyes. Okay. So I'm going to come to the side here, and I'm assessing your corneas, Anthony. And they are clear and light. I'm going to be coming to the front, and I would dim the lights. Okay, and your iris is round. It's blue-green in color. Your sclera is white. Your pupils are round and reactive to light directly and consensually. Now what I'm going to do is, I'm going to take a look at your conjunctiva. It is nice and pink. Okay? And if I put gloves on, I would assess the lacrimal duct for drainage. A normal finding is not to have any drainage. But what I am going to do, Anthony, is I am going to palpate your lacrimal ducts. And I want you to tell me if you have any tenderness.
No.
Okay, perfect. So Anthony, now we're going to look at accommodation, okay? So what I'm going to have you do is follow my finger as I bring it in. Okay, perfect. So Anthony's eyes converged and constricted. His eyes did accommodate. So next what I'm going to do is confrontation. So Anthony, can you cover one eye? And can you tell me when you see my fingers?
I see him. I see him.
And look straight ahead, I apologize. Cover your eye, look straight ahead, and tell me when you see my fingers.
I see him. I see him. I see him. I see him.
Okay, Anthony, so your peripheral vision is intact. Okay, your pupils are equal, round, and reactive to light, both consensually and directly, and they do accommodate. Next thing I'm going to look at is your extraocular eye movement, okay? So what I'm going to have you do is follow my finger. We're going to assess the 6 cardinal fields of gaze. Okay, so start following my finger. Very good. So Anthony's extraocular eye movements were normal. There was no nystagmus, and he had parallel tracking. So next thing we're going to do is take a look at your ears, Anthony. So what I'm going to do is take a look at the auricle of your ear. Let me know if you have any tenderness. I'm just going to palpate.
There's no tenderness.
No tenderness. Okay, I'm just going to press on the tragus. Any tenderness?
No.
And your mastoid, I'm just going to palpate. Any tenderness?
No.
Okay, perfect. So now what I'm going to do is just get the otoscope, and I'm going to take a look in your ear. Sorry. Okay. So, Anthony, just going to come around here. I'm going to pull your ear up and back, and I'm going to take a look inside. And what I see is a pink membrane. I don't see any lesions or nodules. Fine villous hair. The cone of light I can see. Your tympanic membrane is translucent and pearly gray. and I can't identify the bony landmarks. So very good. So Anthony, now we're going to be assessing your hearing. So what I'm going to ask you to do is cover one ear, and I'm going to say 3 words, and you tell me what those words are.
Cat, dog, ball.
Very good. Anthony heard 100% of the words. Next, what I'm going to do is, I am going to do the Weber test, Anthony. So what I'm going to do is, I'm going to start the 5/12 tuning fork. I'm going to put that right on top of your head. And you let me know if you hear better in the right, the left, or if they hear the same. If you hear it the same, okay?
I hear it the same.
Okay, perfect. All right, so next we're going to do the Renee test. And once again, I'm going to start the tuning fork. And what I'm going to do is place the tuning fork on the bone behind your ear, okay? And you let me know when you don't hear it anymore. When you don't hear it anymore, I'm going to place it in front of your ear. And once again, please let me know when you don't hear it anymore. I'm just going to get my watch. Okay.
Can't hear it anymore. Can't hear it anymore.
All right, Anthony. So air conduction was greater than bone conduction, 2-to-1, which is a normal finding. Okay, Anthony. So next we're going to look at your nose. And your nose is midline. I'm just going to palpate your nose. Any tenderness?
No.
And next thing I'm going to have you do is just tilt your nose back. Okay, a little further down here. I'm just going to look up your nose. Okay, pink membranes, fine villus hair. Lower turbinate is visualized. And no drainage. Very good. Now, Anthony, we're just going to look at your sinuses, okay?
Okay.
And what I'm going to do is I'm going to tap on your temporal sinuses and then your maxillary sinuses. And you let me know if you have any tenderness. Any tenderness?
No.
Any tenderness?
No.
Any tenderness?
No.
And all of my assessment would always be done bilaterally.